Hi guys, happy Thursday. Decision day here. Every once in a while you get some sort of pain. Now remember, pain is the last thing to come to tell you there's something wrong. So by the time you do something to create shoulder pain or neck pain, it's probably been happening for a while. Here's an example. So if you've sat and you've been at your computer and you've been typing like this and your shoulders are forward, that's a disaster. It's a disaster waiting to happen. Why? Because all of these muscles are lengthened and weak. All these muscles are shortened and tight, and they create shoulder problems. Okay? It creates neck problems, headaches. Posture is the absolute first thing we have to correct. So here's my story. So doing my best to work out, get in shape and lose a couple pounds from the last couple months, and doing push-ups, and my shoulder starts to hurt, and so it's hard to work when my shoulder hurts, and I got a little glitch, a little impingement. Why? Because I'm not working. I'm working out and I'm working my back, I'm doing that, but something just impinged. So here's the deal. I'm going to show you. I don't know if you can see this, but these are my little acupuncture beads, okay? Acupuncture helps increase your body's internal energy. So there's an acupuncture protocol that you can put needles in, okay? This is my doctor hat, by the way. So being a chiropractor, we work on all sorts of joints, whether it be shoulder, whether it be neck, whether it be wrist, ankle, hip. A lot of people think well, I don't have back pain. Why would I come to a chiropractor? Well, I'm here to tell you that we specialize in every joint, okay? So actually, before you think you need surgery, before you think you need anything, come in, because we can look at any part of your body. We can decide where it's coming from and how to fix it. So being myself, I said, I need to work on my shoulders, and I need some massage in my rotator cuff muscles into my neck, and loosening up these pecs, because that pulls you forward. So as you're strengthening the back, you pull the shoulders down with those lats. Okay, you're decreasing the tip of the shoulders here by squeezing the lats down and then pulling those rhomboids together in the back, and that's going to help those shoulders strengthen. And I promise you, any pain that you have more than likely is due to weakness in a part of your body. It's due to bad posture, it's due to weakness, and it's due to what you're eating can inflame your body and cause things to hurt. Now, not all the time. We need to diagnose what's going on. Could it be more serious? Yes, absolutely. But we're very well trained to do that. And so what I did was I said, let's do this. I couldn't really put needles in myself. So see these they're little tiny acupuncture, I call them beads, but they're teeny tiny needles. And I put them in my acupuncture points. And what happens is full range all the way around. I don't glitch anymore. Still a little sore, but starting to strengthen and just being more aware of how you're doing what you're doing. So in other words, if you don't know that your head needs to be back, your shoulders need to be back and down, gravity and the way you sit always pulls you into this position. And this position is going to cause a myriad of problems, starting with headaches, neck pain, shoulder pain, mid-back pain, lower back pain, hamstring tightness, and calf tightness, foot pain, knee pain, you name it. So it comes from this, guys, head back, shoulders back and down, okay? So the key to this is a combination of therapies. You can't just do strengthening exercises. You can't just do stretches. You can't just do drugs or chemicals, because sometimes that masks the problem and then it only makes it get worse as we go. So as you start to address the cause of the problem, guess what's going to happen? It's going to slowly go away. But you have to continue to be aware of how you're doing what you're doing. The other thing that you have to make sure is that any type of inflammation in your system, you have to make sure that you're not adding to that. Now, adding to inflammation diet-wise is sugars, carbohydrates, chips, breads, rice, potatoes, anything that's starchy is going to increase your inflammation. Okay, so think about proteins. Think about better grains. Maybe some brown rice. If you have to have a rice, eat that in the morning. And for lunch, no starches at night, because that's sugar. Okay, if you're gonna eat fruit, which is great, eat it alone. All right, because that's going to be a starch also. So you have to decrease inflammation. Lots of different ways to decrease inflammation. I went over it in my last video about an alkalizing combination that I use at the office. I also have a supplement called Arthroben, and it helps create more stability in the joint. And it has some great research about you remember Vioxx? It kind of does the same thing as Vioxx does, but it actually helps the joint repair, which is great. Decreases inflammation and actually helps the muscles, the cartilage, the tendons repair. Also, a good collagen supplement in everything. You should have a good amount of collagen every day because of its effect with every joint, every muscle, every tendon, your hair, really every cell in your body. So we went over that last time also with the youth factor. You have your pill, you have your antioxidant that helps with inflammation too. But key is addressing the problem. Never let it continue to go and take medication or over the counter, because that's only going to perpetuate the problem. So if you don't live by me, go to a chiropractor that specializes in sports injuries, that has a knowledge in acupuncture, and use it all. Use the physical therapy, use chiropractic, use yoga, use Pilates. There's so many great things to do with all of these disciplines. And because we're in the environment now of working at home, our ergonomics are not really great for the most part, realize that you've got to do prevention. You just have to, or you wait till it hurts, and then what? And then it takes a while to get rid of the pain, correct the problem, and then strengthen and stabilize so it doesn't come back. So that's the key, is prevention, doing things right now because you want to feel better in the years to come. Doing things now, even though seemingly you think you're fine. I don't have back pain. Why would I do that? Well, because more likely than not, you will be faced with it someday. And a lot of times we're covering up the problem. So no covering up the problem, address the issues, do your posture exercise, come into offices, look on YouTube videos for different exercises that you can do for posture, huge amounts of things, and do them consistently every day. Chin tucks, shoulder retraction, shoulder depression exercises, doing things to strengthen the rhomboids and the lats in the back, huge for shoulder. And go to somebody that can do acupuncture, because it adds such a great component to allowing the body's energy to flow better. So there you go, shoulder hack. Do not put it off, because you're not going to be able to zip your coat. You're not going to be able to put your arm in your sleeve, and don't think that that's okay, because it's not. It can get better. So go search out different exercises. We can help you. You can message me. I can send you some. If you're close, come into the office. We'll put some needles in you. We can use the little, I call them acupuncture to go, but here it is, acupuncture to go. The other day, I couldn't reach around, it hurt, but now, dude, perfect. All right, you guys, there you go, shoulder pain to go. Have a great day.